Well, hello to all our viewers. Good to see all of you. We hope you all are safe. Well, one thing that's on everybody's mind is the impact of the second wave over? Will a third wave hit us? If yes, then when? So we thought we'll allay all those concerns. We'll talk about how much we know, what are scientists saying, what are health experts saying. Joining me on this live broadcast is Runjan. She, of course, tracks developments from the health ministry also very, very closely. Runjan, so of course, as I said, that one question in everybody's mind today is how much do we know of that inevitable third wave? Do we have any sort of a timeline? Now, I believe there's a scientist from the ICMR who's given us some sort of a rough timeline of how soon we could expect. Why don't you talk to us about how much we know as far as experts from the ICMR are concerned?
Yes, Sudhima. In fact, a top scientist from the ICMR has given a timeline, which is August end is somewhere we're anticipating the third wave to hit India. But of course, many factors will play in here. And some of these factors, of course, are going to be the immunity that people have acquired. The natural immunity, first of all. Remember, in the second wave, a large chunk of the population had got COVID-19, had got the infection, but that SEER survey is still underway. So we don't have an exact number of how many people do have the immunity as far as the natural immunity from the infection is concerned, Ridhima. But it would be safe to assume that this time over, as compared to the second wave, a large number of people will have immunity. But for how long does this immunity last? Will it last for 3 months, 4 months? Some say even up to, say 10 months. But that factor will also play in here. Apart from that, variants. And of course, we've seen that as far as the second wave is concerned, Ridhima, the Delta variant, in fact, have created a havoc. Are there more variants that could possibly interfere in terms of escaping the immunity, both the natural immunity as well as immunity which you acquire from, say, vaccinations? That is also something that we need to speed up, the vaccination pace, Ridhima, because more the people get vaccinated, better chance it is for us to be safer. Now, apart from that, the restrictions.
Let's just break this down then. Of course, vaccination and how these variants work across vaccines, that's one aspect. But what are the current variants that we are seeing? The Delta, then the Delta Plus, which we saw in India, and now the Lambda variant, which is also, of course, wreaking havoc across almost 30 nations across the world. Let's talk specifically India. Let's talk about the Delta Plus variant. How much do we know in terms of the efficacy vaccines have against this variant? Because that's the bigger concern, that yes, you'll expedite the vaccine drive, but if these variants can escape the vaccines, then God only knows how you protect yourselves going forward.
Yes, Sudhima. In fact, that study currently is underway, and ICMR is, in fact, trying to determine the characteristics of the Delta Plus variant, whether or not can it, in fact, evade immunity. Is it more transmissible? Of course, early characteristics as far as Delta Plus are concerned have been concerning, not just for India, but the world. For example, a UK health body had indicated that it is capable of not working. It has a resistance against the monoclonal antibody treatment. In fact, it has, more infectious. It anyway is a sublineage of the Delta variant, and that makes it a variant of concern automatically. But will vaccines effectively work on the Delta Plus variant? That's something that the ICMR is currently studying. Ridhima.
Okay, Runjan, now let's talk specifically about the third wave in terms of how much we know, what the government is saying and what health experts are saying. From the pictures that me and you we see every day, our timelines are flooded. All the tourist hotspots, they're completely packed. The locals themselves are now saying that, please, we need to put some sort of a mechanism in place. Otherwise, this is going to be all hell breaking loose. Places like Manali, Shimla, they're completely overbooked. But to be fair, people have also got COVID fatigue. They also feel there's a sense of fear that before any other lockdown is imposed, if any, let's try and go out. The government has a clear message that this is not the time for you to be lax. This is not the time for you to, put your guard down. talk to us about the messaging and the strategy that's coming in from the center of the government, because the government is very clear that we can't give you an exact date or a timeline. Our own responsible behavior or responsible behavior will actually determine when the third wave hits us.
Yes, and like you're pointing out, Ridhima, remember Love Agarwal also at the Health Ministry briefing saying that we can't take the predictions of a third wave as a weather report and go out accordingly, because that's something which is extremely reckless, it's extremely foolish, to say the least, Ridhima. And we're seeing a lot of people give that logic. We're seeing a lot of footfall in hill stations, a lot of footfall in tourist spots. Markets are flooded with people. Remember, this is exactly what had happened before the second wave. We had election rallies, we have religious congregations, cultural congregations. We had a Kumbh Mela organized just before the second wave, and as experts believe, that's where the virus breeds. And of course, the number in terms of getting affected from the virus will swell. So it's on us, it's on the administrations to bring upon the third wave on us. That, of course, also will play a factor, Ridhima. The restrictions that the states are lifting or putting upon. Remember, the health body, Indian Medical Association, in fact, has said that the third wave is inevitable, it's imminent, but it's also urged states to make sure that they disallow large gatherings, because that's something important. And despite the numbers as compared to, say, a month or 2 months ago, yes, they are nothing as compared to that. But can we afford to lose our guard down? Can we afford to lose our guard down? Can we afford to really let a third wave hit us again? Can we just simply forget what we saw in the second wave, Ridhima? That's the question that people like you and I will have to ask ourselves.
Absolutely. Runjan, I mean, it almost looks like that, the sights and scars of the second wave have been completely forgotten. We've forgotten that we're still in the middle of a pandemic. But I want to specifically talk about what the government strategy is. The mantra during the second wave was test, track, and treat. Now the mantra is test, track, treat, and vaccinate, because if you're not vaccinated, that really is the biggest guard and biggest shield that we have currently. But even in terms of vaccination, there are hurdles that India is facing. Experts had said that we should vaccinate about 90 lakh to a crore on every single day if we want to inoculate everybody by the end of that year, by the end of this year. But that really isn't happening, and that's also going to be a huge challenge.
Yes, and to put things in perspective, Ridhima, for now, a little over 5% of India is fully immunized, which means 5% people have received both their doses. Is that enough? Of course it's not. Remember, ever since the policy change of the government of India from 21st of June, when the vaccination policy once again was centralized, the hope was that the vaccination phase will pick up a whole new energy altogether. And it did, remember, in the early few weeks from the 21st of June. We saw on the first day over 88 lakh vaccines administered. But now slowly, as we've moved forward, there's been a huge slump in the vaccination pace that we've seen. Let me point out that for the last 3 or 4 days, Ridhima, the vaccinations in the country have been under 40,000. Some days it's been around 37 lakhs, some days it's been about 35 lakhs, and that's not good because we were anyway vaccinating about 33 lakh people before 21st of June. So we need to pace up the vaccinations. There is no doubt about that. In the middle of that, we're also seeing many states now. The national capital also, for example, raised alarm saying that we don't have enough vaccines. And it looks like we're sort of in that situation again. So this is something that both the center and the state will have to sort out, and there's no doubt that we need more vaccinations.
Runjan, I want to talk to you about another aspect. When we were going through the worst impact of the second wave, a lot of experts had said that a third wave is inevitable, but we'll see a change of pattern. From the first wave to the second wave, we saw how youngsters were getting impacted. And in the third wave, a lot of experts were said it could be the kids and the children who could be impacted. And thus, we need to ramp up our infrastructure in terms of pediatric centers, so on and so forth. How much do we know? Do we have enough data to prove or not prove that maybe children will be impacted in this inevitable third wave?
In fact, Ridhima, remember the Prime Minister also today, when held a meeting with the 6 states where COVID is surging currently, he also mentioned that we need to keep our children safe. And for that, The government is trying to ramp up the infrastructure. There are pediatric ICUs that have been put in place. There are also COVID wards for children that the government is trying to put in place just in case children get more affected as far as the third wave is concerned. Is there a data to suggest that? No. Is there a number that we can point out? No. But what many experts, epidemiologists believe is that the virus changes its demographic. You know, it changes the way it impacts people in order to survive. And it's possible that it's in the first wave, it hits the elderly. In the second wave, it hits the younger more. These are predictions that in the third wave, it may hit children more than it has in, say, the second or the first wave. And which is why we need to prepare, ramp up an infrastructure. There were many mistakes that were made in the second wave.
Yeah.
We want ready in terms of the healthcare infrastructure. Both state administrations, the central government are to be blamed. Many would say we had a huge oxygen crisis emerge in the middle of the second wave when people were dying not just of COVID, but also of not being able to get basic amenities like oxygen, basic medical supplies. So that's something that cannot be repeated.
Right. Runjun, a lot of people who reach out to us every day, the one thing that they want to know is, of course, the timeline of when the third wave will hit us. But from what we've learned, especially from the first and second wave, the hitting of specific waves is not the same for every state. We see a peak in one state and then in another. Any data that is suggesting in terms of which states could be the worst hit and when they could see the arrival of the third wave? And I'm asking this because we're already seeing a pattern. States like Kerala, Maharashtra, they're already seeing a spike in cases. The northeastern part of the country, again, showing a lot of red flags. So fair to then say that the third wave will start with these states and then move to the rest part of the country as well?
Ridhima, since you say that, let me point out that 80% of the cases currently in the country are coming out of 6 states. So that's worrisome. Some southern states, of course, like Kerala, Andhra Pradesh, Tamil Nadu, Karnataka, but also from Maharashtra and Odisha, we're seeing the cases surge. Now, also, there are about 55 districts in the country where the positivity rate is over 10%. When you look at the positivity rate in the country, that is below the 3% mark, but that's not the case in about 55 districts, as I pointed out. And the government, in fact, hoping, reaching out to these states, reaching out to the administration, saying that this is something that we need to control, because if that goes out of hand, then the virus can spill from one corner to the other. It doesn't take time, right? Because the virus wouldn't be state bound. Say it wouldn't stay just in Maharashtra or in Kerala. It's going to spill over to other states. And which is why the government is saying that we need to make sure that the positivity rate across the districts in the country have to be below 5%.
And that really is the worry, Runjun. So then, of course, to wrap this up, we go back to our basics from where we started, which is we continue to wear that mask, follow all our basics of social distancing norms. And this is what the government also seems to be saying.
Can't be stressed enough, Ridhima. And despite the fact that you got yourself vaccinated, we can't not wear masks. We can't go and crowd, clutter public spaces. That is something that we just can't do. Because remember, no vaccine in not just India, but in the world is 100% effective. And which is why that focus again on masks. And in fact, experts now saying that even a single mask is not enough. Try and wear a double mask if you're going out in crowded places. Firstly, of course, try and avoid all crowded places if possible. Of course, it seems that things are getting monotonous. All of us have been homebound for a really long time, Ridhima. These are tough times. There is no doubt about that. But can we risk it at this stage when we can, make sure that a third wave, even if it comes, is not as severe? So that's really in our hands.
Absolutely, because in the last 2 years, if we've learned something, it is that no one is safe till everyone is safe. So it really is in our hands now. If we continue to let our guard down, then third wave, that inevitable third wave, will hit us sooner than later. We'll close this discussion here, but we'd love to hear feedback from you. You could write into us and tell us about topics that you would want us to discuss as well. We're wrapping this discussion for today. Thanks for watching.